My name's Timothy Powell, and today I'm going to be talking about state public healthcare data sources. And so the first public data source for state data is open data portals. So states offer comprehensive healthcare data through user-friendly open data portals, ensuring transparency and accessibility. There's also statewide websites, like I live in Florida, so we have ACA.gov. And so official state websites are key resources providing up-to-date and reliable healthcare information to the public. Also, there's collaboration with nonprofits. So states actively collaborate with nonprofit organizations to enhance and reach and impact healthcare data dissemination. And finally, the goal of this is to provide informed decision-making, public health awareness, and facilitate research and policy development. But also for people like me, it becomes a great source of tools as a consultant or as a hospital provider to have the state data. So the state that has these open data policies, the purpose of which is to publish government data transparently, there's some common elements. And first, data is open by default. So everything that's not restricted is open. So public records, expenditure, legislative records, and it's going to change a little bit from state to state. But generally, data is open, like in my home state of Florida, by the Sunshine Law. So that data is commonly open to the public. There's exceptions for confidentiality and privacy. And there's also a requirement for non-proprietary machine-readable formats, which means we're not going to put it out in Excel. We're not going to put it out in Access databases. We're not going to put it out in SAS. We're going to put it out in comment-limited or text-limited file sets so that people can actually use it. And also, one of the policies is the data is available to the public at no cost. So there's certain features to these open data sets. And first, as we were talking about earlier, is the machine readable format option. So it's going to give you an option to probably export it into text, into a .txt file or .csv file. And it may tell you that it's readable by Microsoft Excel, but it's not specifically set up that way. Then next is application programming interfaces, or some people may have heard the term API. So an API is just simply a code set that allows you to pull data out of one of these open data sets. And so one of the other features is that there's diverse data sources. So I work in healthcare, and so I'm mainly focused on that. But in addition to healthcare data, there's going to be financial, employment, population data. The state's going to provide all sorts of data, some of which may not be directly related to healthcare, but it may be worthwhile having. And also, there's going to be an option to sort and filter data into different sections. So where do we sit right now with this? So in terms of policies, 10 states have open data policies with executive orders and legislations. And then in recent developments, 5 new policies in the last 2 years and 4 amendments to existing policies. But here, most importantly, I think for us is that portals, 24 states currently have open data portals. And in terms of the coverage range of the population, that's the vast sum of the people in the United States. So a lot of the states that don't have these open data portals have much lower populations. So, we're able to cover a whole lot of data in these individual states. Now, if you enjoy the information that you're getting from these videos that I'm making, please make sure that you subscribe to my channel and also like this video, and look forward to talking with you again.